this is my personal opinion, but cancer, or let's say the side effects of chemotherapy, of cancer treatment, can be sometimes more annoying than the cancer itself. And this is what's happening to me at the moment, I have to say. And I'm sometimes very frustrated. I'm not frustrated about the cancer. I can't change it. Well, I can change it. I'm undergoing treatment. But, I can't change reality. This is what I have to deal with. But certain side effects, just drive me nuts. And many people ask if it doesn't bother me that I've lost my hair, that I'm bald or whatever. Sometimes I have a little hair, mostly I'm bald, depends. And I have to say, after 2 years of being on chemotherapy, I've got used to the idea of having no hair. It doesn't bother me at all. I have to say, first of all, I have to mention that I'm on my third chemotherapy now. And my first chemotherapy was for 1 year and 3 months, was called gemcitabine or gemcitabine. And afterwards, I was for 6 months on, about 6 months something, on Votrian tablets. And since end of April, I've been undergoing doxorubicin treatment. Doxorubicin is one of the strongest chemotherapies in cancer treatment. Sorry, this may also be a side effect. I don't know, maybe just the dust allergy. Jerusalem is very dusty. So, okay. There were times when I took the Votrian tablets that my hair came back. It came back in a very funny way, just like baby fluff or something. I had this shaven off from my hairdresser. And then I had some hair growing back, but since I started doxorubicin at middle something of April, I've lost my hair again. And it doesn't bother me. I look at it from this point that it's easier to get up in the morning, you don't need to comb your hair and take care of your hair. You just put on a hat or something and that's it. That's all, what you do with your hair. It makes it very easy and it's time saving, and it's not, you don't have to take care of your hair. It makes it much easier in life, believe it or not. I know that there are people, cancer patients, who are bothered by the fact, or for them it's not easy to deal with the fact that they are losing their hair. With me, it wasn't a problem. Maybe at the very beginning, but not anymore. But I have other issues. Before every treatment, before you actually start your real chemotherapy, you get steroids. You get, this little bag of liquid steroids into your veins. And it may sound like, Arnold Schwarzenegger or something. It's not anabolic or something. It's just medical steroids. But those steroids cost me not only the steroids, maybe also the chemotherapy itself. I don't know what. It cost me to gain a lot of weight. And this is one of the issues really bothering me. When you look at Steve Jobs or other cancer patients, they lost a lot of weight. And I don't want to look like a skeleton or something. This is what I also don't want. But they lost a lot of weight. And I keep on putting on weight. I look like a whale or something. I don't know. I used to have like a normal, my weight used to be very normal, and now I'm bloated and my face is like, I feel like exploding, and I keep on putting on weight and I don't know how to stop it. And, there was a short while ago, I didn't really eat too much for 3 weeks, 2.5, 3 weeks. I had lost my appetite due to chemotherapy. And do you think I lost a kilo? Yeah, maybe I lost a kilo, but not more than a kilo. This was very frustrating. My friends tell me it's like, your body is I don't know, collecting water or something. It's all water in your body. And once you are off after a few months, you're going to lose weight. But in the meantime, I try to go out and I try to move and everything, which is also not easy due to fatigue. I suffer with doxorubicin. I suffer a lot from fatigue. I just sit on a chair or somewhere. Once it happened to me on the tram, that I just pass out and fall asleep. I can do certain things. I wash dishes. I take out the garbage. And then I'm coming back. I have to sit because I'm exhausted. And then I just pass out. And this is a huge issue, that I can't move around as much as I want. I'm used to be very independent and go to work and here and there and run and the whole day and hobbies and blah, blah. And since I've been on this chemotherapy treatment, I have this fatigue issue, sometimes more, sometimes less. But, in the late afternoon, even if I don't do anything during the day or I don't do much, I just pass out. I'm finished. I'm finished from taking out the garbage downstairs. I live on the first floor. I just go downstairs, throw the garbage, in the bin and come back and I'm finished. And I need to sit. Yesterday with a friend of mine came and we wanted to go to the shopping, to the big supermarket, cheap supermarket, Rami Levy here in Jerusalem. And you know what? I made it a few steps outside and then I felt like I can't make it anymore. I have to sit on a bench. And so we returned home. In the end, we didn't go. She went to a different supermarket for me. And I also have problems like cleaning my place. I have 2 rooms. It's not a big place. But, it takes me ages. It takes me ages to get the energy together and to get something done. Sometimes I feel like very energetic. I do something for, 15, 20 minutes, and then I'm finished. And then I'm just finished. And I could, let's say I would go to a gym. I thought about, enrolling in a gym, signing up and doing something. But fact of the matter is that, if I did something, I did some exercises, for example, if I did some exercises, after 5-10 minutes, I'm done. I'm finished. I wouldn't even make it home. I would have to sleep, somewhere on a bench in the gym. And this bothers me a lot, like losing a kind of my independence. And sometimes being dependent on other people. I could clean my place alone. It would take me ages and a few days and lots of efforts. And I don't know how to say it, but especially this gaining weight and fatigue and, and having to deal with this, it's much harder and more frustrating for me than dealing with the whole cancer issue. I think that my current treatment, like doxorubicin, I think that it helps. I'm not sure. I don't know. I'm having my next CT scan next week. Today is Friday. I'm having it on Monday. I'm having my next CT scan. And the last scan in March showed that I have 3 a lesion on the left lung, I think, on top of the left lung or whatever, or inside, or I don't know. And I have 2 stomach tumors, 2, 3 centimeters, something like this, 4 or 5 centimeters between the stomach and the intestines. I have 2 tumors there. I've had them for a couple of months now, one for over a year. And sometimes it's shrinking, sometimes it's growing. Last time it was growing. But usually I feel these 2 stomach tumors because something is pushing. There is pressure at the location where they are. So I feel the pressure. I feel that something is bothering, that something is there. And many times I was in tumor pain of these 2 tumors. And then it turned out that it was growing. But for a month, I would say, even 5 weeks or something, I haven't had any problems. I don't feel any pressure and I don't feel any tumor pain. So I'm very optimistic that either they are remaining the same size or they are shrinking. But to tell you the truth, I'm not thinking about this too much. I'm not thinking too much about cancer. I'm just thinking about that I look like a whale, that I'm bloated, my face is like blown up from the steroids, and I have all kinds of medication, and I take a pill, another pill before chemotherapy together with the steroids. And then I have pills who are helping the chemotherapy, and then I have pills who are fighting the side effects of the chemotherapy. I don't have too many pills, don't get me wrong. Wow, Hashem, I don't have too many pills. But, it's all not healthy for the body. And it feels like, I don't know, you're just losing control. And as a matter of fact, the side effects for me are, really bothering. They're bothering me more than the cancer, as I said. The cancer I almost forgot because I'm not in pain. I don't feel pressure. I don't feel anything. I actually feel great. I just have this side effect issue that, I keep on like being whatever, bigger and bigger and bigger. And I don't know what to do. Maybe any one of you knows what to do or had the same problem. I'm just the opposite of Steve Jobs. Steve Jobs used to lose his weight. Well, a friend told me, he had a different kind of cancer. He had pancreatic cancer, and then it went into his liver. And I have Leiomayosarcoma, soft tissue cancer, and it can start anywhere in the body, even in the joints, in the hip, in the knee, in the fingers, whatever. And I have it between the stomach and the intestines at the moment. I don't think about the lung lesion too much because it's not bothering me at all. But I'm a member of a Leiomayosarcoma cancer forum on Facebook, and there are many people, many members said that they've been facing the same problems. Some put on 20 pounds or I don't know, whatever. But it's really frustrating when you keep on putting weight and you can't do anything against it. I mean, I could run outside and everything. I could do anything, but even when I didn't really eat for 3 weeks, it didn't help. It didn't have any effect on the weight loss. And these are like issues that personally made me forget about the cancer, but now I have to deal with other issues called side effects, which is, I don't know, bothering me more. Like my gaining weight is bothering me much more than the 2 stomach tumors, believe it or not. So I don't know. I don't know what's happening. I just hope that there is shrinkage and that it's getting better, that at a certain point I'm getting off chemotherapy. If someone told me like I can have my normal life back, I would run back to work, just have a normal life and no medicine and no hospital and no oncology and no, I don't know what. Sometimes you're just fed up with everything. I know the caregivers are fed up, but as a cancer patient, you're even more fed up with this, needles and treatment and torture and here and there and appointments and whatever you have. And then you have to deal with the side effects. Well, I don't have too many side effects, but this fatigue and especially gaining weight, it's driving me crazy because it's taking away something from my life, something from my independency. I mean, despite gaining weight, of course, I move everywhere. This, I still feel independent, but it's really frustrating when you look into the mirror. I try not to look into the mirror, especially also not when I don't wear my hat. But maybe you have the same issues. Maybe, I don't know. Maybe you have, I don't know, a formula for me what I can do, to have less fatigue. And it's not that I'm having a bad eating habits or anything, but it just happens. It just happens, and it looks like I just have to go through it. So, well, I wish you a nice chemotherapy, not too many side effects, and may you be among those who lose a little weight. Not to look like a skeleton, don't get me wrong, but to lose a little weight is much better than gaining the weight and look like I don't know what. Okay, thank you very much for listening. I didn't intend to be whining around or something. I'm not. I'm very optimistic, but I do have my moments where I'm really frustrated about the situation. Not the cancer situation, the side effect situation.